Some serious after-effects of COVID have been lingering in the shadows of the COVID-19 pandemic. The remnants of this pandemic are not merely history, but rather a persistent health concern known as long COVID syndrome. Today, we are unpacking several recent reports into this complex topic that is as concerning as it is pervasive. In the aftermath of the initial viral onslaught, a significant number of survivors, up to 80%, continue to grapple with a myriad of symptoms long after their recovery. This phenomenon has been labeled as long COVID, or post-acute sequelae of COVID-19. The U.S. National Institutes of Health has initiated a comprehensive study known as RECOVER, funded by the American Rescue Plan to unravel the mysteries of long COVID. This $470 million study is intended to involve 30,000 to 40,000 participants, harnessing digital data and wearable device inputs to gain insights into the long-term effects of COVID-19. NIH finally launched clinical trials to study the often debilitating condition in August 2023, more than 2.5 years after receiving a $1 billion mandate from Congress to conduct the study. So if we do our numbers, NIH has known about long COVID syndrome and had the money to study it since early 2021 but didn't. Why? Where's the money? The problem has only spread to many more people, creating chronic illness or death during this time. In my opinion, it's criminal to continue to push a drug with serious side effects and the potential for chronic debilitation on people. I have to really wonder what the agenda is here. Long COVID is not a singular entity, but rather a constellation of symptoms affecting multiple body systems. These symptoms can include pain, fatigue, and a condition colloquially known as brain fog. The underlying cause of these persistent symptoms is still unknown, but an autoimmune reaction related to suppression of natural immunoglobulin may be responsible. The impact of long COVID extends beyond the here and now, making this syndrome a chronic illness that can remain with a person for life. The care effect, wherein empathetic doctors significantly improve patient well-being, highlights the importance of a holistic approach to health. The grim reality is that long COVID has already been directly linked to thousands of deaths in the United States. The Centers for Disease Control and Prevention's National Center for Health Statistics reports that long COVID has been responsible for at least 3,544 deaths during the first 30 months of the pandemic. It's important to note that this figure is likely a significant undercount, given that up to 30% of COVID-19 survivors experience long-term symptoms. Recent findings from the Comprehensive Household Pulse Survey conducted across American households reveal that a staggering 40% of adults in the United States have encountered COVID-19 at some juncture, with nearly 1 in 5 or 20% of those individuals grappling with persistent symptoms, commonly referred to as long COVID. Commissioned by demographic enumerators and scrutinized by a consortium overseeing health data, this study sought to gauge the enduring health effects of COVID-19 on the populace. Included in the survey were additional inquiries aimed at assessing the prevalence of lingering symptoms post-recovery from the virus. The key insights from this investigation are as follows. Approximately 1 in 13 adults in the United States are afflicted with long COVID, characterized by symptoms persisting for 3 months or longer subsequent to the initial contraction of COVID-19. Older adults exhibit a smaller likelihood of experiencing long COVID compared to their younger counterparts, with the latter demographic showing a nearly 3-fold increase in long COVID cases. Gender disparities are apparent, with women exhibiting a higher susceptibility to long COVID compared to men. Among racial and ethnic groups, Hispanic adults display a heightened vulnerability to long COVID, surpassing white, Black, and Asian adults in prevalence. Individuals identifying as bisexual or transgender are disproportionately affected by long COVID compared to other sexual orientations and gender identities. Variability in the prevalence of long COVID is observed across states, with Kentucky, Alabama, and South Dakota reporting higher incidences relative to Hawaii, Maryland, and Virginia, with the lowest incidences. In the ongoing battle against COVID-19, researchers are uncovering the virus's impact on patients with neurodegenerative diseases. An April 4, 2024 study in Frontiers in Neurology journal looks into how the SARS-CoV-2 virus affects the central nervous system, shedding light on key pathways and mechanisms. Chronic inflammation and abnormal immune responses emerge as major contributors to neuronal damage and long-term consequences post-COVID-19. For some patients, heightened inflammatory responses lead to the release of pro-inflammatory cytokines, potentially worsening outcomes. Suppression of indigenous immunoglobulin also appears to be a contributor. The research also underscores the importance of exploring links between neuroinflammation and psychiatric cognitive symptoms in recovered COVID-19 patients. Moving forward, efforts should focus on controlling inflammation, post-infection, and finding and eliminating the cause of this often debilitating consequence of COVID-19 infection. To summarize, long COVID is a multifaceted syndrome with varied and persistent symptoms, affecting a considerable portion of COVID-19 survivors. To date, the medical community is rallying to understand its causes, develop treatments, and provide comprehensive care. Yet the journey to fully comprehend and conquer long COVID is ongoing, with significant strides being made in research and patient care. A National Institutes of Health study suggests that up to 1 in 4 adults may experience long-term problems related to COVID-19. Dr. Jordan Vaughn, CEO of MedHelp Clinics in Birmingham, Alabama, and Dr. Pierre Corey, co-founder of the Frontline COVID-19 Critical Care Alliance and medical director of the Leading Edge Clinic, discussed long COVID patients in a recent interview. Dr. Corey said he believes our medical system does not serve the patient. It serves numerous interests, generally financial. He believes the medical system really benefits from patients staying ill and being chronically ill. These physicians have treated thousands of patients with long COVID or long vax. Dr. Vaughn observed a notable trend among previously healthy, active young individuals transitioning from a vibrant lifestyle to a state of debilitation. Moreover, he noted an alarming rise in cancer diagnoses, unexpected neurological conditions, and instances of systemic amyloidosis, conditions typically uncommon or rarely encountered in his clinical experience. Dr. Corey distinguishes between vaccine injury and vaccine syndrome, the latter being a chronic condition. While vaccines can cause acute issues, Dr. Corey and Dr. Jordan specialize in what they term long vax, akin to long COVID, but typically more severe. In Dr. Corey's practice, where they assessed 1,200 patients, 70% exhibited long vax symptoms, often triggered by vaccination. Despite being dubbed long COVID, long vax is not a new ailment but rather a manifestation of myalgic encephalomyelitis chronic fatigue syndrome, ME/CFS, a condition historically linked to infections. The prevalence of ME/CFS, or long COVID, has surged due to SARS-CoV-2, with vaccines utilizing the spike protein, the virus's primary pathogen, exacerbating the condition. People should know that viruses can establish latent infections in nerve cells, a process known as viral latency. During latency, the virus remains dormant within the nerve cell without causing symptoms or replicating actively. However, under certain conditions such as stress or immunosuppression, the virus may reactivate, leading to renewed viral replication and the potential for disease recurrence. The herpes viruses, including herpes simplex virus, HSV, and varicella zoster virus, VZV, are well-known examples of viruses that establish latency in nerve cells. While some research suggests that SARS-CoV the 2nd of May have the potential to infect nerve cells and contribute to neurological symptoms, it's not clear if the virus establishes true latency in nerve cells akin to herpes viruses yet, but long COVID syndrome is consistent with latency. In a world still grappling with the aftermath of a pandemic, the echo of long COVID serves as a stark reminder of the long-term effects of infections and the importance of empathetic, comprehensive health care. As we continue to navigate this post-pandemic world, let us remember the enduring impact of this virus and the necessity for understanding, empathy, and care in our continued fight against long COVID.